Okay, so maybe we'll start off. So hello everyone, and welcome to the sixth session. And unfortunately, it's our last session of the Respect and Shame Healthcare and Bioethics workshop series. However, I'm quite very thrilled and looking forward to continue the discussion which we are having around the concepts like shame, disrespect, and respect, of course. So this is jointly organized by myself. I'm Supriya Subramani. I'm a postdoctoral fellow at the Institute of Biomedical Ethics and History of Medicine at University of Zurich, and Professor Una and Terrone, Associate Professor in Philosophy and Medical Humanities at University of Exeter. So this workshop is funded by Wellcome Trust Shame and Medicine Project. So what the key aim of this workshop series was to critically engage with conceptual and phenomenological understandings of the concepts like shame, humiliation, and other related self-conscious and negative emotions. And also the key aim is to bring together different scholars from different disciplines and who approach these concepts from different frameworks. And we hope to enhance our understanding, basically, to understand these concepts from a multidisciplinary point of view and look at even ethical questions around these ideas. So before moving to our first talk of the session, just a bit of housekeeping information. The first is the workshop will be recorded and a copy of this will be sent to you all. And it will also be uploaded on YouTube. And the key format of this first sessions and the second is the overall is the first presentation would be for 30 to 40 minutes. And then we have followed by discussion for 20 minutes. And then a 10 minutes break, followed by we have a second speaker. And then we have a feedback from Dan to Maryam. And then we have an open discussion on both the presentation, and we can, of course, open the thematic discussion or else from targeted to a presenter. It depends on how we have a flow. And if you have any questions, please use the chat box or of course, or raise a hand and or just unmute yourself and ask the questions too. It would be helpful. On a final note, there will be a special section in the Journal for Evaluation of Clinical Practice arising from this workshop series. We have opened the call for submissions. So if you're working around these concepts and interested to submit, please, we are looking forward for more submissions and we'll be happy to see your paper there. So today, Dan Zahavi will be presenting the paper, Shame, Self, and Other. Dan Zahavi is a professor of philosophy and director of the Center for Subjectivity Research at the University of Copenhagen. He is mainly working on phenomenology and philosophy of mind and the intersection with empirical disciplines such as psychiatry and psychology. Since 2020, he has also been principal investigator on a 5-year research project entitled Who Are We? That's a quite interesting project, I can imagine. So, which is supported by European Research Council and the Carlsberg Foundations. So very excited and looking forward to listening to you, Dan, and over to you.
Thank you so much. Let me just try to share my screen here. So thanks to both of you for inviting me. I'm very much looking forward not only to sharing some thoughts on this topic, but also to the ensuing discussion. So to basically get going, when talking about shame, there's also a certain convention in the emotion literature of talking of what is called the shame family. And I think perhaps one way to get a bit clearer on what exactly shame is by contrasting it with some related emotions. Let me try to see if I can come up with a few examples to illustrate these differences. So let's start with embarrassment. I mean, imagine a scenario where you are expected to meet a friend at a station. You see him across the hallway, go over to him and then embrace him from behind. And when he then turns around, it turns out to be a complete stranger. Now, I think a likely reaction here would be embarrassment. It's socially awkward. You might apologize and perhaps remove yourself from the situation in order to kind of lessen the embarrassment in question. Now, typically, this is not. I mean, what has happened here is not something that will have any lasting impact on your self-esteem. Probably the moment you move away from the situation where the emotion occurred, it will decrease in strength, and it might also be something that you will later on be able to laugh at, and you might, tell the story to your friends. So this would be a case of embarrassment. Then consider guilt. Imagine that you are riding on your bike very fast. Suddenly an old lady steps in front of your bike. You run into her. And it is to some extent your fault because you were driving a bit carelessly. You were immediately concerned about her welfare. You again apologize. You are inclined to seek to kind of redeem or to make up for the damage that you have caused to her. So there's a clear pro-social component in this feeling of guilt, and the focus of your attention is also very much on your actions and the damages that they have caused. Then on to humiliation. Imagine a scenario where, say, you are a young boy leaving school, and you are then accosted by some of the bullies who force you to eat a snail as a kind of a ritual of precisely humiliation. So this is very humiliating. Now your focus might very much be on the people who are subjecting you to this treatment, and you might also perhaps envisage certain scenarios of revenge. So again, the focus is to some extent also on the people who are doing this to you. It's very much felt as unjustified, and again, there might be this idea that revenge could somehow perhaps make up for the humiliation that you have been subjected to. I think it's clear humiliation, embarrassment, guilt, they're all different in interesting ways. Well, what then about shame? Then again, yet another example. Consider the case where you are visiting a friend. He leaves for a moment to do some grocery shopping. While alone in his home, you suddenly discover his diary. You can't kind of resist the temptation of taking a look, and you get so absorbed in all the details that are written here that you forget about his absence and presence. And suddenly, you realize that he's standing just behind you. And when you turn around, you can just feel his gaze. This a gaze expressing, a big surprise that you could in this way betray the friendship and transgress his kind of limits of intimacy. And again, what would that give rise to? I think you could, of course, be focused on the very action that you have performed, namely reading his diary, but it could also, I think it's also likely that you might perhaps start to reflect upon your own quality as a person. You realize that this is really not something you should have done, and that the fact that you did it reflects badly on your being as a person. And I think it's very unlikely that were you to leave the scene, that the emotion would immediately dissipate. And again, I also don't think that it would be very likely that you the day after would tell other people about this affair and kind of joke about it with them. So again, there seems to be something very different going on in shame than, for instance, in embarrassment, where embarrassment seems a somewhat lighter and more superficial emotion. Okay, so starting from this very quick overview, let's try to move a bit further into the analysis of shame. Now, I think importantly, and this is something that most people would, I think, agree to, the specific shame-inducing situation is typically not what the experience of shame is focused on. No, the object of shame is really yourself. So that's also why it's often called a self-directed or self-conscious emotion, something that somehow, again, a metaphor to be used is that it's a bit like finding oneself in the spotlight. So you're suddenly illuminated. There are no hidden sides left. You are kind of exposed in your totality. we feel flawed, vulnerable, exposed when feeling shame. And again, this goes hand in hand with a decrease of self-esteem. Now, when looking at the literature, I mean, one of the ongoing debates is really about how best to characterize shame, because there's a certain partition in the literature. There are some people who very much view shame as a self-conscious emotion. I've already kind of explain what could motivate that kind of label. I mean, the fact that the self is somehow in the focus of the emotion. But there are also other people who want to insist that shame is characterized specifically by its social nature. It's an emotion that very much links us with others and illuminates the specific the specific kind of link that we have with other people. Now, what I want to focus on in this talk is really this question of what the fact that we can feel shame actually tells us about the nature of who we are. What kind of self is affected in shame? And again, to pick up on this distinction between self-conscious emotions and social emotions, one might perhaps ask whether the shamed self is primarily a reflective and self-critical self, or rather a socially determined or constructed self. Now, let me start by looking at one influential shame theorist, namely Michael Lewis. So Lewis is an emotion researcher and also a developmental psychologist. And he basically takes his point of departure in again, a very well-known division between different groups of emotions. And so there's a certain tendency to talk about basic or primary emotions that supposedly arise or emerge very early on in development. So again, there's a little bit of discussion about how many emotions we might be talking about, but the six mentioned here, I mean, many people who buy into this distinction would agree that they belong to the group of basic or primary emotions. But then there are also more complex emotions occurring or emerging later in development, and shame is to be found in this among this group. And so what Lewis does is that he says that rather than talking of primary and secondary emotions, he prefers to talk about non-self-conscious emotions, which is the first group, and then self-conscious emotions, which is the second group. So the division between non-self-conscious and self-conscious emotion is basically the kind of dividing line here. And more specifically, and I think this somehow testifies to Lewis's rather intellectualist or kind of cognitivist take. For Lewis, the presence of self-conscious emotions really requires a possession of a concept of self. And so this also means that that the infant or young child, I mean, has to have a certain cognitive sophistication before it can feel shame. And more specifically, Lewis proposes that whereas embarrassment, that he takes to be a somewhat more primitive emotion, emerges around 18 months, shame actually only emerges around 36 months of age. Now, for again, I mean, to propose a definition, I mean, Lewis basically argues that shame is a very negative emotion that is elicited when one experiences failure relative to a standard, feels responsible for the failure, and believes that the failure reflects a damaged self. And this, of course, again goes well hand in hand with this idea of a decrease of self-esteem. But I think what is noticeable about this definition is that there's actually no reference to others in this definition. And indeed, Lewis goes so far as to say that the publicity of the failure in question is really irrelevant to the nature of the emotion. Now, interestingly, and I find this really kind of well, slightly puzzling, if you will, is that Lewis's main publication here is a book on shame with the subtitle "The Exposed Self." And as Lewis then proceeds to elaborate, what does it mean? What does this reference to an exposed self refer to? Well, as he writes here, what is an exposed self and to whom is it exposed? The self is exposed to itself. That is, we're capable of viewing ourselves. A self capable of self-reflection is unique to humans. So I think what is captured in this statement again is Lewis's commitment to the idea of the relationship between shame, self-consciousness, and reflection. So again, shame is very much a self-conscious emotion. It's very much bound to our self-critical or self-reflective capacities, and there's no reference to others. And I think, talking of exposure, I think it's kind of interesting to compare just briefly what Lewis's statement with what Darwin wrote. I mean, much earlier. When talking of blushing, he claims that it's not the simple act of reflecting on our own appearance, but the thinking of what others think of us, which excites the blush. So interestingly, when Darwin talks about blushing, which is one behavioral manifestation of shame, I mean, he very clearly incorporates the social dimension in a much more kind of explicit manner than Lewis. But then let's move on to one phenomenologist who, I mean, together with Scheler is probably Sartre and Scheler are probably the two phenomenologists who have, at least classical phenomenologists, who have devoted most time to an analysis of shame and are perhaps the most well-known kind of analysts here. So what does Sartre say about shame in being a nothingness? Well, one of the questions that Sartre raises is the question of whether shame is always the outcome of a reflection, which don't forget, was precisely the claim of Lewis. And Sartre is very explicit about shame occurring in different forms. There's not just a reflective form of shame, there's also a pre-reflective form of shame. And as he writes here, this is of course the pre-reflective form. Shame is an immediate shudder which runs through me from head to foot without any discursive preparation. So it kind of overwhelms me. Now, what is the trigger? Well, here again, Sartre is noticeably different from Lewis, because shame is not something that arises as a result of a certain process of reflection that I initiate. No, shame is an emotion, it's a passion, it's something that overwhelms me, and something that primarily overwhelms me in the face of when I face the condemning gaze of the other. So what we actually find in Sartre, in addition to this distinction between pre-reflective and reflective forms of shame, is actually an insistence on shame being a specific kind of self-experience, but one that is other-mediated. And that's why I think that Sartre, and I take that to be a virtue of his analysis, Sartre actually does away with this forced choice between either viewing shame as a social emotion or as a self-conscious emotion, because he actually claims that it's both, that shame testifies to a specific form of social self-consciousness. Now, arguing that others somehow play a role here, of course, still leaves it a bit unclear, well, what role they actually play, because I think we have to recognize, I think it would be very implausible to claim otherwise. We have to recognize that we can indeed feel shame alone. And meaning we can feel shame alone. We can feel shame even if we are de facto, on our own. And of course, the question is whether that fact should somehow force us, despite some of the earlier considerations, to conclude that the reference to others is inessential. And let me give you a few examples that could perhaps illustrate different ways, well, let me give you different examples of shame that might be felt when one is alone. So imagine somebody looking back at his life work and feeling ashamed of who you have or who he has become when compared to how brilliant he was in his youth. That is, one might feel ashamed of not living up to one's capacities, of somehow having betrayed one's potential when kind of, again, looking back at what one has actually spent one's life doing. Oops, there was a small, let's just do the second one here. Again, imagine that you have done something you believe shouldn't be done, or failed to do something you believe ought to be done. And in such situations, you might also feel ashamed afterwards. You might perhaps also feel ashamed about the specific deed in question, but you might precisely also feel ashamed of simply being the kind of person who could do or fail to do such a thing. And of course, all of this can happen even if you're sitting on your own in your armchair alone in your apartment. And again, here's a more concrete example. Imagine that you are an alcoholic. You have made a firm decision not to touch alcohol again. In a moment of weakness, you indulge your urge, commence on a drinking binge that eventually leaves you senseless. When you emerge from your stupor, you feel ashamed of your lack of self-control, of your surrender to what you consider base instincts. And of course, all of this might happen even if there's no concrete audience in place. Two more examples. Here's one. You're together with a group of peers. They start to discuss a political issue. Quickly, a racist consensus emerges that you strongly disagree with, but shame, anxiety, I mean, being anxious about being shamed by the others prevents you from expressing your dissenting opinion in order not to be ridiculed or ostracized. But then later on, when you are alone again, you are deeply ashamed of your cowardly attitude. So it's actually the moment you are alone, the moment you move out of the presence of an audience, that the emotion kind of emerges. What should we say to all of these examples that again seem to illustrate that it's perfectly possible to feel shame also when one is alone? And I think again what we should conclude and what we should recognize is that the experience of shame doesn't require an actual audience. But the fact that there isn't an actual audience should not make us overlook that others might be present in other ways. I mean, others might be present either because we imagine an audience or because we have internalized norms that derives from sociality. And in that way, I mean, others are present, not physically, but nevertheless in the structure of the emotion. And what I also think is important to think about is the following. I mean, even if we can imagine situations where one feels ashamed when alone, well, adding an audience, I mean, doesn't that change anything at all, or might it actually change the actual phenomenology of shame experience? Again, something I think some of the people who are defending a non-social definition of shame have tended not to really address sufficiently. And let me give you some examples where, I mean, again, I've just given you examples where that were meant to show that an actual audience is not necessary. Now I will give you some other examples where I think the presence of an audience actually makes a decisive difference to how the shame is experienced. Here's one example. When writing your latest article, you make extensive use of passages found in an essay by a little-known and recently deceased scholar. After your article has been published, You participate in a public meeting where you are suddenly accused of plagiarism. You emphatically deny it, but the accuser, your departmental nemesis, produce incontrovertible proof. Again, I think a very likely outcome of this would be shame. And I think the fact that it occurs in the presence of your peers is definitely going to have an impact on how the shame is felt. Another case, you are ridiculed by your peers when you show up at high school party in out of fashion clothes, or you apply for a position and have told your friends that you are sure to get it, but after the job interview and while in the company of your friends, you are informed by the hiring committee that you simply aren't qualified for the job. So here again, there's a clear mismatch between how you're presenting yourself to others and the qualities you actually possess, and that clash might precisely be shame-inducing. But what about this? You have been having a row with your unruly 6-year-old daughter, and you finally lose your patience and start to yell at and shake her. Right away, you experience guilt, but then you suddenly realize that the principal of the kindergarten has been observing the whole scene. Again, I think that is going to change the character of the emotion. And finally, you have started a new romantic relationship. After a while, in a moment of intimacy, you reveal your sexual preferences, and your disclosure is met by your partner's incredulous stare. Again, I think shame would be a likely outcome of this. So again, is the presence of an audience in all these cases inessential? I mean, doesn't it add anything at all? Again, I think that would be a very unlikely conclusion to draw. And I think what this all points to is the fact that we should perhaps avoid the temptation of trying to come up with a very clear-cut definition of shame, because doing so might actually fail to do justice to the manifest varieties of types of shame. And again, if one looks at the shame literature, I mean, there is indeed, a number of distinctions occasionally made in between, for instance, disgrace shame, protective shame, moral shame, bodily shame. It's not obvious that all of these different definitions, all these different phenomena can just be captured by one distinct definition. And more specifically, I mean, what I would definitely argue is that there are central and prototypical forms of shame that simply cannot be captured by any non-social definition, like, for instance, the one that Lewis provided, and which I quoted earlier in my talk. Now, here's a further claim. I mean, when looking at the kind of shame that one feels when alone and comparing that to the kind of shame one feels in the presence of an actual audience, might there be a difference in the emotional quality of the shame? So imagine that you are sitting again in your armchair all on your own, reflecting back on something you have done or failed to do, and you feel ashamed as a result. Now, we might call this intrapersonal shame. You are, so to speak, condemning yourself, and this might give rise to feelings of unease, worthlessness, self-loathing. But then consider or compare interpersonal shame. I mean, shame felt in the presence of others, in the presence of, say, their condemning gaze. I think what will typically happen here, and that's also this spotlight. I mean, that is this is what should justify this spotlight metaphor that I was using earlier. There's a certain narrowing of focus. I mean, you can't really pay close attention to details in the environment and at the same time feel acute shame. I mean, it's really as if you are now in the focus, you stand revealed. People also sometimes talk about a change in temporal structure. The now is frozen. It's as if time doesn't pass, just lasts on and on. There's this idea of being trapped in facticity, in the sense that you cannot, when caught in this acute shame, I mean, you don't have the capacity at the same time to envisage all kinds of future possibilities where you might redeem yourself. And finally, and of course, this is also a very well-known feature. I mean, there's this urge to hide, to disappear, to sink through the ground, to become invisible. And I don't think, I mean, to take just that last bullet point, I mean, and it might, of course, be interesting to hear what other people have to say here, but I don't think that that specific feature, I mean, this urge to hide or disappear, become invisible, is particularly salient when feeling ashamed, intrapersonally, simply on one's own. And incidentally, I mean, if you have ever listened to politicians who have done something and then are being interviewed, and then they are smiling to the camera and say, I'm terrible, I feel so ashamed, I think we should simply not believe them. I mean, because you can't really engage in that kind of social interaction if you were really feeling deeply ashamed. I mean, there's some kind of mismatch between their behavior and the emotion that they urge to be captured by. Now, I think one, and again, this is potentially an interesting question, also perhaps slightly controversial. I mean, I think one of the differences between humiliation and shame is that in the case of humiliation, the treatment or evaluation or assessment of others are considered unjustified. I think in the case of shame, it is felt to be justified, even if only briefly. I think if it were resisted, then I don't think it would be felt as shame. Then I think a likely emotion would, for instance, be indignation or again, humiliation. And as already Aristotle pointed out, the nature of those who assess us actually also has an importance vis-a-vis how we feel the emotion, because, as he argues, we feel ashamed vis-a-vis those whose opinions we respect. And so the identity of the audience is actually rarely irrelevant. I mean, whether you are exposing your flaws to family members, to a member of your social network, perhaps in particular a superior, or whether it's a complete stranger, again, is also likely to have an impact on how exactly the emotion is felt and lived through. So it's not just a question of others being present, it's also a question of who those others are that has to be factored in. And again, I mean, their social status and authority is often taken to play a role. Now, there is one again interesting question is the question of the developmental emergence of shame. And we saw that Lewis argued that shame is only possible from around 3 years of age. There's some discussion among developmental psychologists how early one might find manifestations of shame, which incidentally also points to this interesting question of whether shame is experienced differently in the different stages of life. So, I mean, is infantile shame, if there is such a thing, different from teenager shame, different from the shame of an adult, vis-a-vis different from the shame you feel in old age. I think that's again is a temporal perspective that also ought to be considered. And again, pointing to the fact that shame is not just one thing. There are so many different contextual factors that has to be considered. But there's a discussion, and that's what I wanted to point to. There's a discussion among some psychoanalysts about very early manifestations of shame. And if some of you know the so-called still face experiment, where an infant of around 3 months of age is supposed to, I mean, is initially engaging in a kind of proto-conversation with the caretaker. It's very lively, ongoing, synchronous, there's reciprocity, and then the caretaker is instructed to basically have a still face, not to react or respond emotionally at all. What happens in this case is that the infant immediately picks up that something is amiss, tries to re-engage the adult, in so to speak, nonverbal communication. Sometimes the infant will start to kind of look behind itself to see whether that is where the adult is kind of focusing his or her attention. And then when all of these attempts at kind of re-engaging fails, well, then what you see is distress. There's eye gaze aversion, lumped shoulders. And some psychoanalysts have interpreted this as an early manifestation of shame. I mean, because what is going on here is basically that the person you were interacting with suddenly is not reciprocating anymore, is no longer treating you as a subject. And so the idea would be to see shame, or to understand shame, also has somehow been linked to this absence of approving reciprocity, which incidentally also might point to the fact that one way to kind of restore the decrease of self-esteem that you feel when ashamed is precisely by being loved. I mean, that love might have this restoring effect. But again, when looking at the relationship between shame and guilt, again, this might be a relevant difference as well. I mean, you react with guilt when confronted with the anger of others, whereas it is the contempt and rejection of others that can lead to shame. And of course, it's also important, and I mean, this is something that Honneth, for instance, has worked on, that shame, and I mean, so in Sartre's analysis, it's always the condemning gaze of the other. It's by being objectified by the other's gaze. This is what can give rise to shame. But as Honneth points out, I mean, not being attended to by the other, not being recognized by the other, being looked through by the other is also something that can lead to shame. So the absence of a gaze can actually also be shame-inducing, or it's not just one's visibility, this is Sartre's focus, but also one's invisibility that can be shame-inducing. Now, to kind of start moving towards a conclusion, what I think is the case is that shame very much is connected to exposure, vulnerability, and this visibility, invisibility. And my main claim is to some extent to reject the proposal that shame can be understood exclusively in intrapersonal terms, that is, as a self-conscious, a self-reflective emotion. I don't think that kind of definition can capture paradigmatic cases of shame, and I don't think that interpersonal shame can be explained by intrapersonal shame. Now, one might actually perhaps turn it around and wonder whether it could be the other way around. I mean, might it be that interpersonal shame has priority and primacy, and that intrapersonal shame, our ability to direct a kind of self-critical view on our own, on ourselves, might actually be something that is only acquired after we have internalized the kind of perspective of the other, or to put it differently, might it be that other-induced pre-reflective shame is actually more fundamental than self-induced reflective shame? I think that is the case, and I would here quote approvingly the work of Vasudevi Reddy, who is a British developmental psychologist who has argued, and I think this is a very nice actually label. I mean, she talks about shame and other emotions in this family as not as social emotions and not as self-conscious emotions, but as self-other conscious emotions, because they, on her account, makes us aware of our relational being, of the way we are in relation to others. And as I said, I think that that is the kind of paradigmatic, most primary form in which shame shows itself, and that the more refined, cognitively demanding kind of reflective shame is actually a late comer. So again, I don't think it's plausible to claim that all forms of shame can be captured by a non-social definition. I think that interpersonal shame cannot be reduced to intrapersonal shame. I think interpersonal shame is more fundamental. And I don't think that the self-relation that we find in shame is as self-contained and inward directed as some have claimed. Now, Una and Terrone are two philosophers working on emotions who have also written extensively and very, I think, informative on shame. But they are both opposed to what they call a socialist take on shame. I mean, the idea that others are somehow constitutively bound up in the emotion. And I think that a nice way of capturing their a distinction they operate with, namely the distinction between superficial and deep shame, a nice way of capturing that is in the following quote by Søren Kierkegaard. So Kierkegaard writes, "Everyone who went before himself is not more ashamed than he is before all others, will, if he is placed in a difficult position and is sorely tried in life, end up becoming a slave of people in one way or another. What is it to be more ashamed before others than before oneself, but to be more ashamed of seeming than of being?" And so I think what is proposed here is that if we feel ashamed vis-a-vis others, well, then that has somehow to do with, you know, our appearance, with our surface, with some superficial layer of our being, and that is all to some extent not a good thing. What we should primarily be ashamed about is our own non-social being. And so what Una and Terrone actually goes on to argue is that our real identity is the non-social identity, and that is the one that is being targeted by shame proper, namely by deep shame. Now, I don't think that is correct. Now, I would indeed claim that we do have a non-social identity. I don't think our self-identity is true and true socially constructed, but I think that that identity, which I would link to the very fact of being subject, I think that's much too thin to be targeted by shame. I think that the self that is targeted in shame is a richer self. It's a socially co-constituted self, but contrary to what the Una and Terrone and Kierkegaard are claiming, I don't think the fact that that shame self is socially co-constituted makes it less real in any relevant sense. So what I really think that a study of shame and other of these self-other conscious emotions can teach us is really something about the extent to which our social relations, our capacity to adopt and internalize the perspective of others, to what extent that all feeds into and influences and shapes the development of our self. And so to just wrap that up, the claim would then be that that the self that is shamed is precisely a social self, and that even if one might eventually acquire the capacity to feel ashamed alone, well, that capacity is again preconditioned by prior social interaction. Now, what I want to end up with is just a few considerations about the question that also I think came up in Lewis's definition, namely this proposal that shame is a negative emotion. because there is also a kind of ongoing discussion about the value of shame. And some emotion researchers have pointed to the distinction between shame and guilt, and have argued that whereas guilt is pro-social because it kind of motivates us to seek reparation for the damages we have caused to the other, shame is not pro-social. It leads to isolation. It leads us to break our links with others. It motivates us to basically again hide, and that is all negative in all kinds of ways. And so this is why Tangney and Deering, two very influential psychologists, have not only argued that shame is an extremely painful and ugly feeling that has a negative impact on interpersonal behavior, but they have even claimed that our lives would actually be better if it was possible totally to eliminate shame altogether. Now, is that a justified conclusion? Well, if the absence of shame was a good thing, well, then I guess one might wonder why shamelessness is not a virtue. And I think few people would claim that it is. And I think what we also have to recognize, and again, this is something that occasionally is kind of overlooked in the literature. Again, we need to distinguish different types of shame. There might be some forms of shame that are future-oriented and protecting. Again, this is primarily something that one can find in Scheler's analysis of shame. He points to the fact that shame can act as a guardian of dignity. It can be something that allows us to, in order to spare somebody else shame, and so in order to act tactfully, we need a certain sensitivity to shame, and that is not, that's not a bad thing to have. Others are talking about shame, that shame can work as a kind of ethical wake-up call. One might do something, one might feel ashamed as a result, and precisely because of the very violent nature of the emotion. This might actually be something that might motivate us to change our life course and perhaps, start orienting ourselves in a more morally acceptable manner. So again, it's not clear that not having shame is in any way something we should strive for. Finally, think about the link between shame and self-respect. I already mentioned that shame is linked to a decrease of self-esteem, but that, of course, also goes hand in hand with the presence and persistence of self-defining values. There's still something that is important to one. That's why one feels ashamed. In a kind of nihilistic scenario where everything had lost meaning and value, I think it's doubtful that we would any longer feel ashamed. Now, again, I don't want to paint a too rosy picture here of shame. Shame, on the one hand, might be important for our moral development, but of course, it might also lead to social conformity. Shame anxiety, the fear of being shamed by others might limit our initiative, might force us not to act, not to break with what the in-group is claiming, and all of that might, of course, again be bad in various ways. And finally, when talking about shame and also the temporal dimension of shame, I've specifically and repeatedly talked of acute shame. Shame that is so to speak episodic. But there's also in the literature, often discussions of what is known as chronic shame. Where, for instance, as a result of childhood abuse, there's a certain pervasive atmosphere of shame, and of course, nobody would claim that is, a valuable thing. So there are undoubtedly forms of shame that are very, very negative, very destructive. But I just want to to also say that only thinking of shame as something bad, I think is simply not getting to the core of this emotion. So thank you very much for your attention. And here, I mean, there are a few references to some of the literature that I have drawn upon in preparing this talk. So thank you very much.
Oh, thank you, Dan. That was really great, really insightful and thought-provoking and really rich. I'm going to chair this next few minutes with questions. So if anyone has a question, you can raise your hand, your virtual hand, or you can type it in the chat. So Sarah, you've already got your hand up, Sarah. Hello.
Hi. Thank you very much. This was really, really interesting, clarifying. And I wanted to ask you a question, and well, on one kind of shame that you didn't talk about, discuss this, the shame of the oppressed that Sandra Bartke spoke about. I use it in my work on discussing about obstetric violence, women going through violence in the labor room, and having, I mean, this tool of shaming for perpetrating this violence. And I mean, Bartke speaks about this like like kind of a group shame, a social shame, people that are ashamed like existentially for their mere way of being, regardless of what you did. You are already living with this profound and very, when you spoke in the end about chronic shame, so this is a kind of chronic shame, very pervasive and also unproductive, she says. And I was wondering, how would you frame it in terms of the intrapersonal and interpersonal, and also maybe the phenomenological feeling that you talk about that a little bit, about the different phenomenological responses or expressions of this kind of shame, if you have some thoughts about this. Thank you.
No, thanks a lot. I guess the first thing I just want to say, because that at least would perhaps be an obvious potential objection, because I mean, I made this claim at one point that that for me, shame somehow seems to presuppose that the person who feels ashamed thinks that the assessment or the verdict is justified. And of course, one could then say, well, what am I saying here? I mean, doesn't that have some strange implications? And I remember many years ago when I had started working on this topic, I gave a talk on Iceland, and this was right after they had this big bank. There was kind of, the whole country was close to going bankrupt, and people were telling me that as a result of the way in which I think the National Bank had handled the Icelandic economy, I mean, many Icelanders, if you can call them that, I mean, they actually felt ashamed. And so there was some kind of collective shame going on here. And I think this was supposed to be an objection in the sense that, of course, they were not in any case responsible for the mismanagement of the finances. And I think the point I mean, what I said back then was that I'm not saying that it's I don't think that, I mean, I'm not saying that if you feel shame, then the verdict is indeed justified. I'm just saying that in order for you to feel shame, I think that's the psychological mechanism. Somehow you are internalizing that perspective. And it would be much better if they didn't do it. So it's not because I'm trying somehow to legitimize or rationalize it. I just think as a kind of psychological, analysis, I think it somehow has to be internalized, because if you didn't take it in, then I think, again, a more likely emotional response would be indignation or humiliation or something like that. So just to say that as a first point. And then I guess, I mean, when asking me about whether it has more to do with intrapersonal, interpersonal. I mean, I would certainly say interpersonal, and I think, as you said yourself, I think this has very much also to do with in-group, out-group, or with group identification. So it's not only about you as a solitary individual. It's very much about, you know, the group that you take yourself to belong to, and the way that group as a whole is assessed or appraised, often by, you know, more powerful groups. And so I think it kind of raises, I think, a lot of very interesting questions about how does group identification affect self-identity. And also, I mean, just to throw in yet another term that I haven't talked about, I mean, the whole phenomenon of vicarious shame, I mean, feeling ashamed on behalf of others, which is also, I think, a very interesting phenomenon. So it's just, I mean, I'm not really, you know, doing justice to your question, but I think what I just want to conclude by saying is that there's really so many different dimensions of shame. And again, I mean, what that I think should teach us is that this might be a philosopher's perhaps you know, weakness, this idea of, well, let's try to come up with, you know, a definition that can somehow capture the whole thing. I'm not sure that is really the most productive way of getting to these matters.
Thank you very much.
Thank you. Gina has her hand up.
Yes.
Hello.
Hello. Thank you so much. I was going to ask about vicarious shame because I work on national identity, and being Swedish, I've worked recently on the lack of shame, but also the shame in Swedes with regards to the Swedish COVID policy. So I will just take this opportunity to ask you if you could elaborate a bit on vicarious shame and whether or not the same reasoning that you're applying to non-vicarious versions of it applies to that. And secondly, I just had a question on religion and Protestantism, because to me as a political theorist, what comes to mind when you were talking about the intrapersonal, the interpersonal, was Charles Taylor's Sources of the Self. I don't know if that's within this literature at all, but that's a sort of biased view of Protestantism, but there's certainly an element of truth to the claim that perhaps this is culturally perhaps the extent to which we can view ourselves from the outside is dependent on partly the religious tradition and the extent to which Protestantism, not least, has focused on this confessional aspect within diaries and having a clean heart. And Kierkegaard certainly is within that tradition, right? So yeah, I'll stop rambling and just be interested in your reflections on these.
Yeah, no, thanks a lot. I think I think especially the second part of your question, again, of course, once again widens the scope because I mean, they're not just different types of shame, and it's not just that perhaps through one's life there might be different ages of shame, but of course you could also adopt a kind of cross-cultural and also a historical perspective on shame and try to investigate to what extent shame at different time periods might have had different expressions, and also whether, I mean, different cultures, whether the shame experience in different cultures are different. So that's, of course, a very rich material for both historians and anthropologists as well. And given that I'm talking about that now, then let me see if there's anything else I can say about the second question. I mean, I have to confess that I don't really remember what Taylor writes about Protestantism, I have to say. But I think my hunch would be, I mean, that there's no question that culturally and historically, you know, what causes, I mean, what might be the trigger of shame can, of course, very much change through history. I mean, I have one example, which I think is also funny. I mean, that, nakedness is often connected to shame. And I think there's even an etymological discussion of shame, if I remember correctly. It has something to do with the term, with word schema. I think that somehow has to do with hiding or protecting oneself. And so I guess many of us would associate, being seen naked as something that would be shame-inducing. But there are these stories from the royal courts that it was very customary for nobility and royalty, I don't know, 400 or 500 years ago, to basically have servants around who helped them undress and who usually saw them naked, where there were no shame involved here. Whereas I'm sure that had the royal figures been seen naked by their peers, of course it would be shame-inducing. So again, there's this whole social, not only does it point to the importance of social hierarchy, but I also think it says something about how much, the norms might change over time, and whether something counts as shame-inducing or not is, of course, very much, relative. But I think, but the point I just wanted to make was that even if what actually triggers the shame might change through time, I think what is ultimately, and again, this is perhaps my universalist inclination, I mean, even though, the specific circumstance can change, I think what is ultimately at stake in the shame, namely something about, fragility, vulnerability, exposure, a clash between ideals and facticity. I think all of those, those are what is at stake, regardless of what the specific circumstances are. And so I would also, I would be, I think I would be skeptical against very, cultural relativistic claims that shame in, I don't know, in a Japanese culture is completely unlike what we find in Europe. Again, I think there might be a lot of differences, but insofar as we are talking about shame, again, it has to do with something relating to self-identity, recognition or failure of recognition by others, etc., etc. And then back to your first question about vicarious shame. Well, I think and I don't know if I have super much to say, but that's of course one thing one could immediately say, and that is that the people who are pressing for this non-social definition of shame, they of course have an even harder time accounting for something like vicarious shame. It seems very strange. How could such a non-social definition ever get to what is actually being displayed in vicarious shame? And then I think my way of reasoning about it would be to say, to just give two examples. Imagine that you have invited a business colleague out to a performance in the Royal Theatre. It's your child who is performing, who's the main actor, and everything starts, and then your child comes in and is completely drunk and basically has to be brought out. I'm sure that would probably be shame-inducing in some manner, especially if the person you were together with, you were trying to somehow impress that person. And then another case might be, and I think this is also a classical case. You are traveling abroad, you suddenly see compatriots who are behaving absolutely atrociously. Again, you feel ashamed. And I guess that the challenge is, well, why in both of these cases are you feeling ashamed? If shame somehow targets the self, and if in both cases it's not really you. And I think my only way of trying to make sense out of that has to do with group identification somehow. That the relation, be it to other compatriots, or to other family members, that your identification with them is somehow crucial to your own social or collective identity. So I think it's somehow, I think we need to look at the relationship between self-identity, narrowly conceived, and then larger or more encompassing forms of identity like social or collective identity, and how they affect self-identity. It's that kind of interrelation that I think we need to focus on if we are to somehow make sense out of a phenomenon like vicarious shame. I think that would be my kind of way of thinking.
I'm just going to say that I assume that in theory you could feel vicarious shame, say, for your compatriots without there being any audience. So I think these are two different dimensions of the social aspect, right?
Yeah, but do you think so? I mean, because I'm not sure actually. I mean, that's an interesting question. But imagine that, I don't know, I come across a group of drunken Danes when I'm traveling in Italy. It's very late at night. It's on an empty square, and I just see that they're standing there and peeing on a statue.
Realistic.
Yeah, I know, it could be realistic, yes, perhaps it is. But I don't know. I mean, is it excluded that I could feel ashamed here, even if there's nobody around? I'm not sure. I mean, I don't know. I mean, I guess, this points to something else that I've also learned. I think it's impossible to construct a scenario that would necessarily be shame-inducing for everybody. I mean, in that sense, what for some might merely result in embarrassment might for others result in shame. I mean, it all depends on also how they are interpreting and taking in the specific case in question. So I mean, perhaps it says something relevant about our difference. I mean, that perhaps I would feel ashamed when coming across these compatriots and you not. I don't know. I mean, but
no, I definitely would. Yeah, no, okay. I agree.
Thank you for the question. I'm going to just say we're running over time. So what we might do is stop now and have a break. I'm just going to post the schedule into the chat, and then we can resume. There's an open discussion after the next talk where we can resume questions with Dan as well, and maybe link the two talks together. So we'll take a 10-minute break now. Yeah, Supriya, is that right? And then shall we come back?
Yeah.
Yep, come back at 20 past. Yeah.
Yeah.
So more like a 12-minute break. So yeah, we'll be back then at 20 past. See you then.
So shall we start, Luna? Okay, great.
Yeah.
So thank you, Luna and Dan, for the first session, and Dan for having a great, insightful understanding for us to give us on shame and the relation to self in particularly. It was quite fascinating to go through this process in itself with these questions. And so now we have second speaker, Maryam Golafshani. I'm sorry if I get the second name of yours wrong. Okay, perfect. So she'll be presenting the paper Empathy and Shame Through Feminist Phenomenology, the Limits and Possibilities of Affective Work in Healthcare. And Maryam studies medicine at the University of Toronto and previously earned her BA in English Literature, Theory and Criticism, and MA in Critical Theory. Broadly, her research is interested in how medicine functions affectively, discursively, and phenomenologically and politically, and how it can and should change. I mean, that's quite interesting for me to see from that perspective, the way you work, Maryam. So please, over to you, and I'm looking forward to listen to your talk.
Thanks so much. So I'm just going to quickly in the chat put a typed copy of my talk, which can hopefully help folks with disabilities or not follow along better. And now I'm going to share my screen. Oh, mulled wine is not the right screen. This is also not the right screen. Here we go. Although it would be nice if we could all have this talk with some mulled wine. And let me go to my first slide. There we go. Okay, so you see my first slide, right? Amazing. Thank you, Dan, so much for that talk. I feel like especially the ending about the kind of positive and negatives of experiencing shame or having shame in the world fits really well. So you already heard the title of my talk, and I'm in my third year of medical school now at the University of Toronto. Previously did my MA in undergrad in English Lit and Critical Theory. I'm going to start by reading two tweets because Twitter is a place we see a lot of shame thrown around. Organizing works, activism works, shaming works, #people's vaccine by Naomi Klein on Twitter on May 5th, 2021. Now another tweet. There are numerous studies confirming that shaming does not work and that empathy and listening to concerns actually has the highest conversion vaccination rates. Shame is a tool of oppression. It will never be a tool for social justice or public health. That's by Brene Brown, also on May 5th in response to Naomi Klein's tweet. So on May 5th, 2021, the US government announced that it would support a proposal to waive patent protections for the COVID-19 vaccine. Naomi Klein, a prominent Canadian American political activist and author, retweeted the announcement by White House News reporter Jenny Leonard and added her own commentary, which I just read above. Less than an hour after Klein's tweet, Brene Brown, a popular American psychology professor and author known for her work on emotions and vulnerability, replied with criticism of Klein's statement that shame works. A debate followed in the replies to both tweets, with many people clarifying to Brown that she actually misunderstood Klein's original tweet. Klein was not writing about shaming individuals who are vaccine hesitant, but rather shaming a government who fails to put public and global health above private profits. Regardless of this misunderstanding, Brown and her supporters doubled down on their stance that shame does not work in any context and is not justified for any reason, regardless of whether it is directed at individuals or institutions. These tweets raise critical questions about the varied and vexed ways in which shame works in healthcare. What does and can it do, and for whom? To begin answering these questions, I'm turning to Luna Dolezal and Sarah Ahmed's feminist phenomenologies in their respective books, The Body and Shame from 2016, Strange Encounters from 2000s, and also Ahmed's feminist affect theory in her book, The Cultural Politics of Emotion from 2004. The first half of my presentation will explore the phenomenologies of shame and empathy, and the second half will explore that theory through the case study of COVID-19 vaccines. So to begin, what even is shame? I'm going to be much briefer than Dan, so I can get to the rest. On the one hand, shame is an intimately personal feeling, and on the other, a highly social and even political emotion. Dolezal theorizes that while shame is an intensely personal and individual experience, body shame only finds its full articulation in the presence, actual or imagined, of others within a rule and norm-governed socio-cultural and political milieu. As such, it bridges our personal, individual, and embodied experiences with the social and political world which contains us, end quote. Similarly, Ahmed theorizes that while shame often pulls the self away from others, think averted eyes, literally turning away from others, the subject of shame takes in the view, so think feelings, judgments, perspectives, of how they appear to real or imagined others, thereby seeing themselves as if they actually are what the other perceives. Ahmed thus alerts us to how shame is fundamentally an experience of double exposure. On the one hand, and this is a quote, shame covers that which is exposed. We turn away, we lower our face, we avert our gaze, while on the other, shame exposes that which has been covered. It uncovers, end quote. Dolezal emphasizes how, quote, body shame involves exposure and the seen body. One is seen by oneself or by others, whose views and judgments one shares to be doing wrong or to be failing or flawed in some crucial way, end quote. These views and judgments shared by the shamed subject do not just come from the one who shames, but rather from a broader system of socially, culturally, and even politically constructed norms that are transgressed or failed to be met by the shamed other. This is the critical feminist analysis Ahmed and Dolezal bring to the phenomenology of shame. That shame is not merely produced in the vacuum of an encounter between the I and a real or imagined other, but rather entangled in wider cultural, social, and political systems like sexism, racism, ableism, and more. Dolezal goes on to theorize that, quote, shame can only find its full articulation within a normative framework. More than an encounter between two bodies is needed. Instead, a whole complex world of language, culture, and normative values must be in place, where certain behaviors, actions, or modes of being are prohibited and seen as deviant, and others are socially sanctioned and considered normal or acceptable. End quote. Ahmed would similarly describe such an experience of shame as the, quote, affective cost of not following the scripts of normative experience, end quote. So now that we have a better handle on the feminist phenomenology of shame, I want to offer a window into its phenomenology by exploring shame's relationship to its supposed opposite or other, empathy. I know this conference is on shame and respect, but when I think of respecting another's views, actions, or person, I think ultimately of striving to really understand where they're coming from, hence getting us to empathy. If we turn to the initial tweet I quoted by Brown, we see how she posits empathy not only as the antithesis of shame, but even its antidote. Shame does not work, she asserts, but empathy does. This reflects a broader discourse on how empathy can be a cure for everything wrong in healthcare. Here's an example. Medicine's paternalism and even shaming of patients can supposedly be cured if doctors are just trained to be more empathetic of their patients. This kind of empathy is often trained through patient expert panels, communication skills workshops, reflective writing, and even reading literature in groups. Here's another example. Healthcare worker burnout can supposedly be prevented and even cured if healthcare workers find ways to reconnect to the deep meaning and relationships that are central to their work by, for example, using techniques like reflective writing to empathize with their patients as a whole. This line of thinking suggests that shame and empathy are phenomenological opposites. The shaming subject judges and pushes away a shamed other, sedimenting them as other. Meanwhile, the empathizing subject supposedly understands and moves closer to the other, transcending their otherness. Ahmed's work is critical here as it can help us see the fallacy of empathy as cure by revealing how empathy, like shame, also risks producing an other. Empathy's phenomenology is surprisingly similar to shame, albeit with some critical differences that will help us further nuance the phenomenology of both empathy and shame. So Ahmed theorizes that, quote, shame requires an identification with the other who, as witness, returns the subject to itself. The view of this other is the view that I have taken on in relation to myself. I see myself as if I were this other. In other words, the shame self takes in the view of real or imagined others' feelings, judgments, and experiences, reshaping themselves through the lens of that other. Similarly, the empathizing self takes in the view of real or imagined others' feelings, judgments, and experiences, or at the very least tries to take in the view, and reshapes themselves through the lens of that other. But the first critical difference between the phenomenologies of shame and empathy I'm describing is that the I or self of shame is the object of the action of shaming. That is, I'm describing the phenomenology of shame from the perspective of the one who is shamed rather than the one who is shaming. The I or self of empathy in this parallel phenomenology, however, is the one enacting empathy rather than the object of that empathy. So the reshaping of the shame subject and the empathizing subject also take different forms. This shamed subject is reshaped as if they are what they assume the other imagines them to be. Whereas the empathizing subject is reshaped as if they are what they themselves imagine the other to be. As a result, the empathizing subject strives to reach towards the one being empathized with, whereas the shamed subject turns away from the one who shamed them. But what can ultimately happen in both the cases of empathy and shame is turning the objects of the verb, the one who is shamed or the one who is empathized with, into another. This is more obvious in the case of shame. The one who is shamed is identified as having transgressed some norm, which identifies them as other to a normative group or convention. The case of empathy is a bit less intuitive, but Ahmed can again help us here through her analysis and critique of Emmanuel Levinas in her book, Strange Encounters. In reaching out to understand or know, or at least claim to know, the empathized object, the empathizing subject risks transforming the other from one kind of other Ahmed would call the stranger, someone we know as not knowing rather than somebody we simply do not know, into another kind of other that we know as known, someone produced as a category within knowledge rather than coming into being in an absence of knowledge. This transformation requires a kind of transcendence, as Levinas theorizes, of the other that actually cuts them off from the complex web of context, circumstances, and connections that brought them to encounter or face the empathizing subject in the first place. This transcendence makes it possible to empathize with and wholly understand an other, but in a fetishized manner that reproduces them as an other cut off from the cultural, political conditions and relations that brought them to such an encounter in the first place. Thus, it is not only a phenomenology of being shamed, but also the phenomenology of empathizing that can risk reproducing the other as other. The shamed self as an other who is known to be outside of a norm, or the empathized object as an other who is known outside of the context that brought them there. But it is important to note that I am saying this othering through shame and empathy can happen, not that it necessarily always does or has to happen. This is where feminist phenomenology offers a different approach to empathy that does not transcend or fetishize another, but rather seeks to recognize and attend to the cultural political context of the one who is being empathized with. This also raises the question of whether shame also has such possibilities. Perhaps if shame is not levied towards individuals who transgress cultural political norms, but rather levied towards institutions that create and contribute to reifying such norms in the first place, shame can be used in productive, progressive ways. When shame and empathy are simplistically viewed as working in opposition rather than teasing out the nuances of where and how their phenomenologies are actually similar, shame remains an unquestioned bad and empathy remains an unquestioned good. I mean good as in the adjective, a good, even noble way to interact with others, but also good as in the noun. Empathy produces the object of its attention as an other, as a kind of fetishized good. Dolezal argues that, quote, that shame is, quote, a permanent, necessary, and structuring factor of identity. However, it is also a double-edged force. It contains the potential for individual and social transformation, while also containing the potential for world-shattering, personal and social devastation, end quote. I think empathy is also critical and indeed fundamental to identity development through relationships with others. But empathy, too, is a double-edged force that contains the potential for individual and social transformation, as well as the potential for world-shattering personal and social devastation. When healthcare views shame and empathy as working in opposition, it maintains the illusion that empathy is only good and shame is only bad, thus missing the double-edged potential for both to be either transformative or oppressive at the individual or institutional levels, depending on how they're used. In order to explore this further, we need to expand our view of the phenomenological encounter beyond just a meeting between an I and an other as two individual human subjects. I turn to Ahmed to do this because for Ahmed, quote, meetings do not have to involve the face-to-face encounter of at least two subjects. Meetings do not even presuppose the category of a human person. More generally, a meeting suggests a coming together of at least two elements, end quote. Such elements could be a patient and a doctor, of course, but also the objects in such an encounter, like a stethoscope and heart sounds. If we move outside the confines of the doctor's individual office, we can think of the encounter between patients waiting to be seen by a nurse practitioner and the space of the waiting room itself. Perhaps the encounter between the electronic medical record system and thousands of patients. The encounter between a hospital's institutional policies and resources and the people who work within their confines. The encounter between what counts as, quote, best practices in an evidence-based medical model and other medical models. The encounter between biomedical knowledge and other forms of knowledge, like philosophy as we're encountering today. This is how we can start to move between the phenomenology of shame and empathy at the level of one-on-one clinical encounters to the level of encounters between a mass public and global and public health systems. It is in this expanded view of phenomenological encounters that the conflicts between respective individual autonomy to vaccinate or not and collective responsibility to the health of others comes into view. Through analyzing collective expressions of national shame in Australia regarding the nation's failed responsibilities to Indigenous peoples, Ahmed theorizes that, quote, the expression of shame is a political action, which is not yet finished, as it depends on how it gets taken up. Shame, in other words, does not require responsible action, but also does not prevent it, end quote. Expressions of empathy are like shame insofar as they are also unfinished. Empathy does not always prevent responsible action, but it does not necessarily require or include it. Empathy prevents responsible action precisely when it is perceived to be a completed responsible action on its own, thus foreclosing the need for any further action. Ahmed continues to explore how the Australian nation, quote, may bring shame on itself by its treatment of others. For example, it may be exposed as failing a multicultural ideal in perpetuating forms of racism, end quote. She also goes on to explain how those who witness the past injustice of through feeling national shame are aligned with each other as well-meaning individuals. If you feel shame, you are in the a nation that means well. In other words, our shame means that we mean well, and we can work to reproduce the nation as an ideal rather than actually bringing tangible justice to Indigenous peoples. This applies to empathy. Those who witness the injustices faced by their patients through feeling empathy can prevent responsible action when they become aligned with each other as well-meaning individuals who reproduce healthcare as an ideal, empathetic, helping enterprise without actually having to do the necessary work to make healthcare more just in a meaningful way. On the other hand, however, such empathy could alert one to the injustices in healthcare and incite them to actually take further responsible action. So depending on how empathy or shame are taken up in healthcare, they can end up working for or against oppression, for or against transformation. So now let's finally move to the case of COVID-19 vaccinations. Shaming unvaccinated individuals or group can also align such well-meaning individuals in a way that reproduces themselves as an ideal group in such a way that does not necessitate and sometimes even prevents responsible action that would actually change vaccination uptake. This is where we can start to see how shaming individuals or groups for not getting vaccinated does not necessarily work, as it is only an unfinished political act in Ahmed's terms. However, in the opening example of shaming the government for allowing private corporations to maintain patents and profits off the COVID-19 vaccine, we see how shame did indeed work to incite a further political act, that is, denying these private pharmaceutical companies the right to patent the vaccine, which will make vaccines ultimately more accessible globally. That's somewhat debatable to what extent that's happened, and hence hopefully tangibly increase vaccine uptake. So in the words of Naomi Klein, shame worked against oppression as just one, albeit small, step toward global vaccine equity. But if we return to the context of shaming individuals or groups rather than institutions like the government or private corporations, one can easily imagine or have experienced how such shaming can in fact prevent responsible action by alienating the unvaccinated person, triggering defensiveness, and ultimately pushing them further from ever getting vaccinated. As such, we begin to see shame's potential to work depends on whether it is levied at an individual or institution, or something in between. In the example above, shaming the government made visible its role in global vaccine inequity, and this heightened visibility through shame incited the government to be tangibly politically responsible and responsive. Dolezal writes, quote, "Shame is about visibility. When one experiences shame, one is seen by oneself or others to be doing something untoward or inappropriate," end quote. Pushed further, when one experiences shame, one is not just seen by oneself or others to do something untoward or inappropriate, but to actually be something untoward or inappropriate. To see an individual who is not vaccinated as being untoward, even morally inferior, is a very different thing than making visible an institution or a system as such. This is where the empathetic view of unvaccinated groups comes in. Many strive to empathize with, for example, unvaccinated Black folks by claiming to understand how it is reasonable, given the history and present case of racism in Western medicine. Here, the capacity or willingness to empathize is dependent upon recognizing what systemic factors are at play with regard to COVID vaccination or hesitancy. Just as it's critical to consider how the reasons for not getting vaccinated are dependent on social structures, it's also critical to recognize that, quote, shame is not experienced in the same manner by all subjects. In fact, the propensity to shame and its consequences is very much dependent on one's position within a social group, end quote. And that's again from Dolezal. It's not just the propensity to shame that is determined by power, but so too is the propensity to be shamed and to respond to it. Each body does not have equal power when it comes to returning or receiving the look. As a result, some bodies are more prone to shame than others, is how Dolezal puts it. This is where feminist phenomenology of shame and empathy that accounts for cultural politics comes in. Is the shame around vaccines disproportionately levied towards and harming already oppressed subjects like Indigenous, Black, and disabled communities who may have valid reasons to mistrust Western medicine? And if empathy is to be effective in convincing such vaccine hesitant subjects to get vaccinated, then it must attend to such systems at play. But here we find a double-edged sword yet again. In such a move to empathize with unvaccinated people by attending to the cultural politics of their relationship to healthcare, such oppressed groups have been thematized as mere victims of healthcare without the more complex capacity to think or act beyond that trauma. In other words, through empathy, these communities become mere objects of their circumstances, fetishized objects of poverty, racism, ableism, and more. When we look at the data in Canada, for example, this objectifying empathetic perspective on vaccine hesitancy actually proves false. Vaccination rates for low-income adults and those with lower educational levels are actually higher than higher-income adults and those with higher levels of education. Indigenous people below 60 also have higher vaccination rates than non-Indigenous people, and the rates above 60 are nearly equal. Groups identified as visible minorities through the Canadian census did have lower vaccination rates than non-visible minority adults, but again, such data must be considered critically. How is the category of visible minority constructed in the first place? And what does it mean that this population is generally skewed towards younger ages? That is all to say, it is not just shame that objectifies unvaccinated populations in unhelpful ways, even harmful ways at times, but so too does empathy by sometimes directing our vaccination attention and efforts in the wrong places. We can also turn our attention to how healthcare workers are being shamed for, on the other hand, pushing for not only increased vaccination uptake, but also vaccine mandates. In a Lancet article on COVID-19 online shaming and health professionals, Luna Dolezal, Arthur Rose, and Fred Cooper remarked how the 2020 resurgence of the hashtag #NoToDoctorShaming on Twitter highlighted the problem of online shaming of health professionals. Doctors are often held up to superhuman standards that demand infallibility. Common human occurrences, such as making mistakes, falling sick, needing sleep, or displaying emotion, could be potential opportunities for shaming. Working on the front line of medicine, healthcare workers are often blamed or even perceived to be responsible for system-wide problems like staff shortages, short appointment times, insufficient bed space, PPE shortages, long wait lists, or limited treatment options. Such pressures are compounded by the emotional and physical strain that comes with working long hours and having high caseloads, all of which have been exacerbated during the COVID-19 crisis. So here, shaming healthcare workers themselves for being weak, fallible, burned out, and even angry prevents the kind of political action that is necessary to actually improve the working conditions for healthcare workers and, in turn, patient care. One such political action would be to mandate vaccination to decrease COVID-19 rates that are pushing such healthcare systems and the people who work in them to the brink of collapse. In my own province of Ontario, here in Canada, we have seen the script of shame flip such that healthcare workers are shaming the government for its inaction regarding vaccine policies, leaving the burden to care for those who get COVID-19 to our already overworked healthcare workers and systems. Meanwhile, there have even been anti-vaccination protests happening outside the very hospitals I work at, where ambulances are even blocked from reaching the hospital and individual healthcare workers are shamed and harassed upon entering and exiting the buildings. Here, shame is again levied towards individuals and ultimately allowed to do so by a government that is unwilling to take serious political action. On the other hand, there's been a rise in empathy towards supposed healthcare heroes most notably demonstrated through the healthcare heroes movement across the globe. There is a renewed understanding, respect, and empathy for how difficult a healthcare worker's job is and how they rise up to such a challenge. But here again, empathy forestalls political action by still putting the burden on individual healthcare workers to be overworked heroes without actual systemic support. Again, here in Ontario, we've seen backlash by healthcare workers themselves against being called a healthcare hero, precisely because it distracts and absolves institutions from necessary action to improve the working conditions of such supposed heroes in tangible ways. One such policy that's necessary is instituting vaccine mandates, which at the time that this was published had not happened yet and was kind of in conversation. Many hospitals by now instituted their own vaccine mandates, but the government has yet in Ontario to make it a requirement for even hospital workers, let alone the population at large, to be vaccinated. In the case of healthcare worker burnout, a perhaps better approach to empathy than the healthcare heroes narrative would be one that makes visible the many failures of a healthcare system to actually support its workers. From the 26-hour shifts, even I, as a medical student, am required to do every 4 days, to the government's failure to mandate vaccines in hospitals at the very least. To be completely honest, I'm not even sure what I'm really referring to every time I say healthcare system, because in my limited experience running around looking for misplaced patient chart binders, because yes, we still use physical charts, and sending faxes into what seems like the abyss, because yes, we still use faxes, it feels a lot less like a system and a lot more like a bunch of individuals working super hard to keep something barely afloat, because at the end of the day, they all really do care about patients. I don't have any tidy conclusions. This is a workshop after all, but these are my earliest thoughts on how shame and empathy in general, and in the context of COVID vaccinations in particular, might work in more complex, and sometimes even contradictory ways than they're typically considered. And I think attending to such complexity is necessary if we're to work towards effectively levying affects like shame and empathy towards justice rather than oppression. Thank you.
Thank you so much, Maryam. It was quite interesting to see the way you put shame and empathy as a double-edged sword and how we can engage in these discussions within this emotions which plays in, especially within the COVID vaccinations. So Dan, could you, please go ahead with the feedback or the comments, and then Maryam can respond in case if she has or anything, and then we can open up the discussion. Is that okay?
No, absolutely. So thanks a lot, Maryam. So I mean, I just have a few comments and a few questions, and I guess one comment is basically just a reference. I mean, when having this discussion about whether shame works, I mean, whether it's a good way of motivating people to change their behavior. I think a very incisive discussion of that can be found in a book that you didn't reference, but a book by Martha Nussbaum called Hiding from Humanity, Discussed Shame and the Law. I think she has a lot of very convincing examples there that also kind of questions the extent to which shame is, if you will, an educational, helpful, or whether shaming is educationally helpful. So just as a kind of a suggestion for further reading. Now, as it happens, I think actually most of my questions concern your discussion of empathy, which is also something that I've kind of worked extensively on. But let me just ask one question about shame. So you kind of mentioned in your initial definition that shame is not simply a private bodily emotion, but also a political emotion. And I guess I just want to put a little bit of pressure on you here. I mean, I guess what I want to know is whether you think that shame can be a political emotion, or whether it sometimes is, or whether you would kind of bite the bullet and say that there's always a political dimension to any form of shame. I don't know if you have any kind of comments to that.
Yeah, I think, I guess it depends what the definition of politics is, as if the definition of politics is very broad and that just engaging with others in a society that has certain power structures at play. So in just this very broad sense is what is politics, then there's kind of no way for anyone to escape that. And thus that will always to some extent be determining the what kind of norm or perceived transgression you are making, because there's always, I guess I'm thinking of Arendt, and there's always this kind of audience, and thus we're always all playing in a political, even if, sorry, I'm not being super articulate. I guess I think that if the definition of politics is broad enough, it is always political. But then I think about it, there might be instances in which the shaming is, for example, you're being shamed about something that is transgressing a norm, but that norm isn't a wider norm. Perhaps it's a norm just within your small group of friends. And it's not something that's upheld as a norm by a wider, I can't think of an example, but perhaps in your small, this seems like a trivial fact, but I can think of as teenagers in your small group of friends, wearing a certain color, like orange, has been deemed to be uncool. And then you show up wearing orange and you're shamed for that. I wouldn't say that that is necessarily, that would not be a political form of shame. So I guess now that I'm talking it out loud, no, not all shame is always political, but I do think the kinds of shame that I'm talking about are always political.
Yeah, no, but I guess, I mean, I think you're putting the finger on the important spot. I mean, it very much depends, of course, on what kind of definition of political you're operating with. And I guess the slight concern would be if one operates with a very broad definition, I mean, then it also becomes a little bit empty to say that it's political. And then I guess one could run a similar argument saying that, I mean, all perception is political, or I mean, a lot of things would be political if one kind of opted for that. And perhaps it wouldn't be such an interesting claim. But I think I would agree with you that in many cases, and especially in the more kind of refined or developed cases of shame, I mean, they're very, very often a political dimension. It's just that also, I mean, you know, think of some of these developmental findings. I mean, if it were the case that, you know, being sensitive to the absence of loving recognition, I mean, if that's something that children, very, very young children, are sensitive to, I mean, again, what is political here? I mean, unless you kind of again operate with a very, very broad definition. So I think I would be more happy about, yeah, I mean, operating with a slightly narrower definition of political, and then say, well, there are some cases where it's undeniably present, but perhaps not in each and every instance of shame. But let me move on to empathy, because I think, well, as I'm sure you also know, I mean, a lot of feminologists have worked on empathy as well. And I mean, I wonder, because I don't think you actually do that, but I mean, if you were to offer something approaching a definition, I mean, would you be happy to kind of do that? I mean, what exactly do you actually mean by empathy? Because I think in your talk, it's a little bit as if you're assuming that, well, we all kind of know what empathy is, so we don't really need to be very specific in what it's supposed to target. And of course, the fact is that people are actually quite in disagreement about empathy. There are all kinds of definitions and very different ones. So I wonder if you could just, as a starting point, say what do you actually mean by the term yourself?
Yeah, I mean, I probably somewhat intentionally avoided putting out a definition of empathy because I know it is so almost contested, and at this point in my early career, I feel so confused about what empathy is. And so that's why I took this approach. Sorry, this isn't giving a definition of empathy, but maybe you can help me by I'm trying to understand what empathy is by through understanding what something related to it is. So I'm using shame as a way to try to help me understand what empathy is better, because I think there was a time when I thought I knew what empathy meant, which is like putting yourself in another person's shoes. And then there was a time when I hated empathy and I was like, you can never understand another, and anyone who tries to do that is just appropriating the other. And then this discussion of shame got me to somewhere where it's more in between, but I don't think I have a definition, I would agree, but trying to understand how, through recognizing that shame is kind of this, in Luna's terms, like this double-edged force, helped me realize that there's empathy is doing both, and it's not so much about its definition, but perhaps maybe the definition would help with this, but it's more about what are its effects. That's kind of what I'm concerned about. And especially in healthcare, because it gets thrown around a lot. Sometimes my personal frustrations, and I bring this up in the paper, is that, okay, just being empathetic towards my patients doesn't make the healthcare system less racist to them. Just because being empathetic doesn't make me less burnt out because I found some like great meaning in my practice. So yeah, I'm not sure of a definition, but I guess I'm trying to carve out a bit more of a definition or a precise understanding, at least, of how empathy works by understanding its relationship to shame. Is there a definition you would recommend?
No, so I mean, I have a specific question concerning the relationship between shame and empathy as the last one. But let me just say, I mean, this idea that empathy might not necessarily be a good thing, I mean, that it might also have kind of nefarious way of functioning is of course actually something that a number of people have been pushing recently. I mean, perhaps you know of the book by Paul Bloom, Against Empathy. I mean, so I think there has been a certain backlash against the proposal that empathy is basically the universal solution to all global problems, and if all of us just became a bit more empathetic, I mean, then everything would be good. So I do think that, and I would agree with that empathy can be used for manipulative purposes. But I think one thing that I didn't really understand, and I think this might have to do with also perhaps the fact that you are drawing on Sartre Ahmed, which again in my ears just sounds strange. So I wanted to kind of again ask you for a little bit of further clarification. I mean, if I understood you correctly, you were saying that one of the reasons why empathy is nefarious is because it risks reproducing the other as other, or that the other is reified as other. And again, I don't know, I mean, coming from a more Husserlian Levinasian background, I mean, I don't even understand why that should be a problem. I mean, in the sense that it's precisely what we really should do is to respect the other as an other and not simply reduce the other to sameness or identity or emphasize the similarity between us. So in my vocabulary, treating the other as an other is precisely recognizing that the other is always more than what we grasp. The other always eludes us. There's always a transcendence to the other, always more to the other, and that recognizing that is all a good thing and not something that is really bad. I mean, so I was just a little bit confused by the way you were kind of playing the argument, because it was a very different way of talking that I'm kind of accustomed to. So I don't know if you could say a little bit more about, I mean, I don't know, that potential danger compared to, again, just viewing the other simply as a copy of me, or just projecting myself into the other, and thereby actually disregarding the otherness of the other and replacing the other simply by a kind of taking the other as a mere substitute for myself. I mean, do you have some kind of thoughts on this?
Yeah, I guess this kind of gets, a bit into definitional territory as well. So then there's like the other as you're understanding it, and as this kind of phenomenological concept or entity that can't be wholly reduced, and thus you'd want to keep it that way. And then there's like the act of othering, which is kind
of exclusion or ostracizing.
Yeah, and for Ahmed, there's like a Marxist part of this where for her it's fetishized othering, fetishization in the sense of cutting off the other from the kind of, not just circuits of production, but the, what are the political, cultural, economic, what are all those factors that ground the other in a reality? So it's not just a face that appears, the stranger isn't just a face that appears to you from a vacuum, but rather we actually do want to understand the particularities, not the particularities of the other as a being that would essentialize it as like having, for example, a gender as if that's an essentialized thing, but what are the particularities of the system of patriarchy, for example, that leads to us to encountering perhaps a feminized other. So what she's trying to do is say that what someone like Levinas is approached to the other risks doing is by trying to maintain the other, he's actually producing a different kind of other that can be cut off from the particularities of race, sex, like the systems that make these things as they are. And the problem with this for her becomes then we get to this issue of the unfinished political act, because once someone is cut off from these particularities in an effort to recognize the other as this kind of transcendent, I can never wholly understand it, almost absolves us of the responsibility to recognize and thus politically act on these particular realities that informed why they faced us in the first place. So it's not so much a critique. It's, I guess she's kind of arguing, and what I would argue, it's that it's a certain kind of fetishized other that is formed is the issue. Does that make sense?
Yeah, no, I think, it's just a different, I mean, it's a different take, but I think I can understand why it could potentially be problematic to, and I guess that has always also been one of the criticisms of Levinas. That emphasizing so much the transcendence of the other. It also becomes a bit otherworldly, if you will, and that recognizing the context in which the other is emerging is, of course, also important. I guess my only concern would be, and I don't think that is what you are saying, would then be if one were to claim that everything about the other can't be explained simply by referring to these social powers. So that the other is true and true socially determined. I think that would be, also perhaps going too far in a kind of constructivist way. But I think I understand better now what the point was. For the sake of time, let me just end with one question, which again comes to, I think, the main focus of your talk, namely the relationship between shame and empathy. And so I think what I would, my way of putting this, and I do have I have an answer myself, but I'm curious to know what your answer would be. So here would be, here's the question: does shame presuppose empathy? Have you any thoughts of that? I don't think empathy presupposes shame. At least I don't really understand how that would work. But I think there's an interesting, perhaps, reverse connection. Could you feel shamed? Could you feel ashamed? Could you be shamed if you didn't have empathy at all?
I don't know if presupposes, but I guess that's what I'm getting at. There's some weird similarity in that they both in some way require kind of imagining of the other. And thus, does that mean, like, in order to feel shame, you have to kind of imagine in order to feel shame, you take on the view that others have towards you as having, for example, transgressed a norm, and thus then you feel shame. And in some kind of strange way, that is almost like analogous, as if you are empathizing with the other. You're trying to empathize with what these other people are under their view or perception is of you, and you're empathizing with them, although you're empathizing with them having a negative view of you. Does that make sense? So it seems like
Yeah, no, but I mean, perhaps it somehow comes back to the initial question of how exactly we define empathy, because I mean, I think many phenomenologists would actually not be so happy about the idea that empathy is some kind of imaginative perspective taking. They would rather view empathy as some kind of more perceptually based other understanding. So it's not about me imagining the other, it's rather about me understanding the psychological life of the other in a face-to-face encounter. And if my shame is partly induced by me picking up the condemning gaze of the other, or the disapproving face of the other, well, if I weren't able to do that, I mean, if others were completely enigmatic to me, if I couldn't pick up the kind of psychological significance of their expressive gestures, intonation of their voice, etc., I mean, then I think shame would have a very different character. And just as a final remark, I mean, one place potentially to explore this further would be by perhaps looking at a clinical population. I mean, because there are some disorders that are sometimes called empathy. I mean, some clinical populations claim to have empathy deficits. One potential claim here, one potential group would be psychopaths. Another might be individuals with autism. And then, of course, where the interesting claim would come up would be, well, if both of these populations do indeed have empathy deficits to some extent, do they then also have problems with feeling ashamed? And there might actually be empirical evidence supporting that. And so if that was correct, I think, again, one might be able to establish some kind of interesting connection between these two concepts that otherwise, perhaps at first sight, seem to be very far apart.
I think going into autism, as someone who's kind of embedded in disability justice communities and critical disability studies, there's a lot of, from actual folks with autism, criticism of this kind of like psychological and psychiatric understanding of empathy, and of them as thus not having the capacity for empathy. And so I wonder how that would complicate this in looking at that population. So maybe it would be interesting in that regard. And then this is where the politics of it comes in again, because there's, I think, an ableist politics as well informing what we understand empathy to be and its like importance. And thus that comes into how the ableist views of folks with autism who thus supposedly lack this, and then like perhaps shame too. So I guess, yeah, those are my preliminary thoughts on that, which I know isn't what you were getting at exactly.
No, but I think that is obviously relevant as well. I guess the only, I mean, I can just refer to one exploration by Peter Hobson, who is a very well-known psychopathologist and developmental psychologist who has done, I think, a lot of very important work on autism. He's, I think, is one of the few people who have actually explored that specific question. I mean, of shame. I mean, to what extent can one, do they? And of course, also it's a bit problematic to talk in that way. But I mean, how prevalent are shame in individuals with autism? And that seemed to be one of the findings he were pointing to. But yeah.
Okay, interesting.
Okay.
Thank you.
Oh, my pleasure.
Great. Well, we can, we've still got about half an hour, so we can open it up for questions and discussion. I was just going to say, Sarah put a comment in the chat, which I'll read out. I think this is in context to your previous discussion about others. I think in this context, she says, maybe Beauvoir's conceptualization of women as the absolute other might help. Woman has become not a Hegelian necessary other, but an absolute other who cannot enter in conversation. I don't know if that is relevant or helpful. And then Ken, you have your hand up, so we'll just. Hi.
Hi, thank you. So this is remarkable discussion, and I hope you'll forgive me that I'm coming in. This is my first morning thinking about this, about shame, and so there may be other discussions and things in literature that I've missed. But first, I would, if you don't mind, I'll add a quick comment about autism. Don't know Peter Hobson's work that Dan just referred to. My understanding, and I've done a little, I know a little bit about this, is that most of the reactive and empathy challenges that you find in autism have more to do with cognitive empathy than emotional empathy, so that people don't understand what other people are thinking. And so since they don't have the kind of facts online, that's why they don't have the emotional reaction. But that's my understanding of it. But I was really interested in hearing what the speakers had to say about a kind of dynamic between the acts of shaming that Maryam was discussing and the self-understanding self-identity that Dan was thinking about, because it strikes me that there are multiple ways that shaming someone can fail. And one of the ways that we've seen, I think, around vaccine compliance and vaccine refusal is that on the one hand, people try to shame someone, but it fails because they're working with assumptions about what the other's self-identity is. And in fact, it may even dynamically make a change in the self-identity of the other by trying to shame them. They say, oh, okay, he thinks I'm one kind of person, the kind of person who will feel bad by about not reaching this norm. So I'm going to shift then, right? And even, dig into a different self-identity, an oppositional self-identity. So I think there's a dynamic there that's worth exploring. I also think in terms of this really rich interplay between empathy, and I understand why, Maryam, you put this out as a kind of social discussion of empathy, not one that you necessarily need to pin down, right? It's sort of what's going on, how people are talking about it. So I appreciate your, that you didn't necessarily find a need for that. But I think in part, what we find, in this sort of idea of shame as a mismatch between, or revealing a failure to reach, an expected standard, which could be an internalized expected standard. Maybe one type of empathy may be appropriate or useful even in this context when we sort of try to shame someone into doing something, or we feel like, you should be ashamed of this. The empathy, can reveal to us that this person may have taken on an oppressive self-identity, an expectation, or we may be projecting onto them an identity of somebody who can do something, and therefore, ought to do something and can do something that in fact they can't do, right? Because of their situation, but maybe maybe neither side realizes that. So those are some ideas I'd like to hear you explore.
And Maryam, why don't you go first? I mean,
No, you go ahead. I'm still collecting my thoughts.
Okay. Well, let me just pick one thing at least. I mean, this was this question of why are some attempts of shaming unsuccessful? And I think, I mean, what immediately came to mind when I was hearing you saying that was this Aristotle quote that I mentioned in my talk. I mean, this where Aristotle says that, it's the opinion of people we respect that somehow has the potential of affecting us. And I think that seems very right to me. I mean, if people whose opinions I do not at all respect are providing negative assessments of me, I mean, the impact of that is just of a very different nature than if it's coming from people I respect. And I was kind of thinking when preparing this answer, I was kind of thinking of my sons, whom I obviously do respect, but I mean, sometimes they're saying, what a boring job you have. I mean, it's total waste of your life that you're spending so much time on philosophy. And, you know, somehow it doesn't really affect me that much. I think I can withstand that kind of criticism because I'm not sure they really know what they're talking about, to put it like that. So I do think it has a lot to do with that. And I mean, the whole in-group, out-group, I'm sure that, say, anti-vaxxers might be more affected by other anti-vaxxers and being criticized by them than by those they really regard as the enemy, so to speak. So I think, so I would take that fact, the fact that we are not always shamed, even though other people are trying to shame us, as testifying to that. And of course, it might also have something to do, and that was also something that I think hasn't really been brought up in our conversation this afternoon. I think there's a lot, I mean, one's personality type can make a huge difference. I mean, I think there are very interesting books also discussing, you know, the role of shame in psychotherapy and how people in different ways can try to work with the shame experience and get on with their lives. And I mean, again, the way you can respond. I mean, one thing is when you are hit by the acute shame, but how do you then get onwards? How do you get over it? And I think, again, some people might externalize the blame and try to say, well, it's not really about me, it's about the people who are trying to shame me. They are the evil ones. I mean, other might internalize it completely and basically kind of be destroyed by the shame. So I think, again, and depending on how self-confident we are, and I don't know how much of social anxiety we have, again, all of that, I mean, is something that also has to be factored in when trying to understand these processes. Maryam, are you happy to say?
Yeah.
So I think the instance of when people aren't, I actually had I was just looking through my notes because I had this whole thing where I was trying to write about that. When you try to shame someone and they don't feel shamed, or is it that they lean into the shame, but then is that not shame? And I didn't get anywhere, as in I was very confused about that whole instance. So I'm really glad you brought it up and to hear your thoughts and Dan's thoughts on it. So I don't really have much to add because I've been feeling stuck about that. But and when I worked on this paper, I actually intentionally chose to just focus on Luna's books and Sarah Ahmed's books because there's so much written on this stuff. I wanted to do kind of a close reading and to inform a short talk. So I really read both books closely. And there was a section, Luna, in your book where you write about shame having this social dimension so it's not just the social political informs and shapes shame, but that shame also can shape the social and political context. And so we think about if someone just in a group is shamed, that becomes this kind of social awkwardness, and it shapes the entire as a millennial like me would say, vibe of the social setting. And then we can think of that on a bigger scale as well, and thus people generally tend to avoid shame. But then I was thinking about this in relation to the case with COVID vaccinations, where the harm actually doesn't come from trying to avoid shame and thus a kind of disappearing act, but rather the harm comes from not avoiding the shame, and thus someone who is anti-vax and then is shamed but kind of still puts their foot down and refuses to get vaccinated. And then there's some would perhaps say that is kind of what fuels bolsters the anti-vaccination movement. And then that then goes on to shape our cultural political scene. And we see that when, this has spiraled and bolstered the anti-vaccination movement to the extent that now there's people blocking the hospital entrances to have their protests while they're simultaneously being shamed. So I guess I'd like to hear your guys' thoughts. Are those people not feeling the shame, or are they stepping into the shame?
I wonder
Like-
if there is, whether it's a successful shaming. You say that they are shamed, but it's almost like an attempt to shame them, or it's a shaming action, but it doesn't succeed. It fails. The shame actually doesn't happen in a way.
I'd love to say something here, because Dan, you've asked me this question before when I've given talks about the difference between shame and shaming. And I'm just putting in the chat a link to a paper called Swimming in the Sea of Shame, which I found really useful on this, where they talk about shaming as a completely separate thing from shame, where shaming is like the performance of normative values. And it doesn't matter if it's received as shame, but actually it's like the performance for a wider community of your morals or your norms or your values. And so how it lands, whether it lands as shame or it lands as a rejection of shame, isn't really the purpose of the act of shaming. So maybe that's a way to think about why it's its own kind of thing, where the point is to make people feel like they've done something wrong or there's something inferior and invalid about their actions or themselves. But the performative aspect of it is what is like the key force. But yeah, sorry, I just threw that in. That paper that I've just popped in the chat is a really, really good one. I can move on to the next question unless Dan or Maryam have more.
Sorry, if I can just say one thing, because I guess one, and I don't think I have a very clear answer myself, but I wonder whether, would it make sense to distinguish then between, attempting to humiliate somebody and attempting to shame them? Because I think because when it comes to humiliation, I'm not sure that it's completely irrelevant whether it's actually taken in by the other or not. I think part of the goal in the humiliation is precisely to enforce a certain view on the other that one is then hoping the other will actually internalize and accept in order to really, destroy the self-respect of the person in question. So it's just so I don't know whether that actually is an argument in favor of distinguishing between the two, because I can fully understand what you mean by talking of shaming as this more social process where it's just as much to other people. Rather, it's not just about the target; it's also to all the peers, and I can see that. But yeah, so I don't know. Again, I don't know whether in English it would make. Again, it's not my mother tongue. So shaming, humiliation. Is there anything there about them being synonymous, or perhaps one having to distinguish between different types of shaming, different types of humiliation? I don't really know.
Yeah, I think what you're saying, the distinction that you just drew, I think makes sense, where humiliation it's almost like targeting an individual.
Mm-hmm.
Yeah, I hadn't thought that through, but I think what you're suggesting, like the different types of shaming, is also needs some nuance as well. Mm-hmm. And maybe a shaming that was targeted at humiliating an individual wouldn't necessarily have that performative dimension where you're concerned about the audience. Let's move on to the next question, just in interest of time, because Supriya and Sarah both have their hands up. Supriya, would you like to go first?
Thank you, Luna. This is a question for Dan, actually, on when you ended with the questions of negative and positive understanding of shame, right? So I was wondering, would you place shame in the moral sphere? For example, what I mean is the value of shame as a moral emotion to self-regulate a person's moral identity in itself or future actions. And you were referring to the idea of self-confidence, a person who is having self-confidence, right, can really deal and engage with the shaming process, whether it can be internalized or like really, shook off in that sense. But then my question, or I was thinking through, people, especially the vulnerable population who have been at the stake of structural violence for a very long time, how can we demand, is it like when the shaming is happening to them, the self-regulation is asking too much from people who has been constantly been oppressed or like constantly being shamed, right? So then what is the role of moral emotion there of shame? Thinking out loud and asking you the question of the value of moral emotion in that sense.
Yeah, well, I think I have to think out loud as well, because I don't know, perhaps it depends a little bit on what precisely we mean by moral emotions. I mean, if we mean emotions that potentially kind of play into the moral domain, then I think shame is an obvious candidate. But if we by moral emotions mean emotions we should encourage because they are necessary for moral development, I mean, then I think it's somewhat more tricky. So I think the point I wanted to make was that I think shame can, I mean, I think one can conceive of situations where shame actually have a positive moral effect. I mean, this moral wake-up call could be one instance, for instance. But of course, one question would be whether, in the best of worlds, whether there might not be other avenues that are perhaps even better. I mean, you know, so take the moral wake-up call. Perhaps it would have been even better if the person could have just found the right way without having to go through that episode of shame. And likewise, I mean, think about. I mean, there's this issue about the temporal direction of shame. So, I mean, shame can be very much this frozen now when you are caught in the condemning gaze of the other. So that's connected to the present. Shame might also be backward looking. I mean, when you, for instance, subsequently reflect upon something that you suddenly realize were shameful. And that's, I mean, that's a different temporal structure, obviously, than being caught in the eyes of the other. But there's also a futural form of shame, which I think is often connected to this shame anxiety. I mean, again, and perhaps to take a very concrete example, I mean, it's a while since I were in that situation, but perhaps teenagers who spend hours trying to dress for a party and are very unsure, you know, what is the right way to dress. I mean, perhaps one of the reasons why they are choosing so carefully is partly to be explained in terms of this shame anxiety. I mean, they are afraid. What they want to avoid is a situation that will produce shame. So it's not about shame happening right now. It's about an imagined future shame. And so talking about the moral, I mean, the role of shame for moral development, I mean, there's this whole thing about conformity, not stepping out of line because one then risks being condemned by others. And again, I think it serves an obvious purpose. Now, is it necessarily a good thing? I mean, I don't really know, because you can also see how that in all kinds of ways might be limiting. So again, to just wrap up, I mean, I think it's ambiguous, and I think what I primarily wanted to say was just that the idea that shame is exclusively negative, and that our lives, as our you know, that human existence would be better if we completely eradicated shame, I think is not really a plausible model. But I mean, but there's just a difference between, you know, opposing that view and then promoting shame as a useful tool in moral development and education. And there I think I would side with Nussbaum. I mean, using it as a kind of stick to make people behave better, or to use it in child, I mean, to raise your children by shaming them, I think is really that, I mean, that is much too destructive. It's really undermining their dignity, and I don't think that's valuable. Yeah, so that was all scattered thoughts.
Thank you, Dan. Supriya, do you want to say anything?
No, thank you. Thank you, Dan.
Great, thank you. And then Sarah.
Thanks. So just say something about this comment that I did before. It was in the context of if making the other is ethical or morally good or not. And I think maybe it will be useful really to distinguish between two kinds of othering. You know, the kind of othering that recognizes the otherness of the other, and the other kind of, othering the other absolutely and turning turning him or her into an it or something like that. So that will be the bad othering. So maybe that will be useful. And the question now for also for Dan and also for Maryam about this political power of shaming as a way to contest oppression that others have made on us or institutions. And Luna, thank you for this resource that I'm opening also. But I'm thinking concretely on this, the consequences of the Me Too. Sometimes the Me Too, the shaming, using the shaming as a tool, to try to just to point out to the others who have made these kind of things, and sometimes, and I'm thinking about this this thing that you discuss now about the ones who would not take the shame because they don't respect who is shaming them. So how useful the shaming is when this the one who acted in this I don't know, disgraceful ways don't respect the subject of this of the act that they put on them. And again, it's also, I think it's important for the peers, to I mean, it's maybe sometimes it's more important for the group doing the shaming than for these people that are being ashamed. But I'm thinking also it in the context of the Me Too protest, which is taking place from some activists, for example, in my field, from childbirth, or for example, shaming these institutions that have made violence to patients, and like calling them out and saying this cannot continue, etc. So, I mean, the use of shaming here in this context, I don't know how politically useful you think could be. I think sometimes these, for example, medical institutions don't really respect patients, or, I mean, if other doctors, what has happened to me is that if other doctors tell doctors that something is being done wrong, so this is very powerful, no? But if, for example, even an academic, but a feminist philosopher like me comes and says these things, they're not very ready to take the shame or to react in this case. So I don't know if you have something to say about it.
I have some thoughts, not on every point you raised, but on so you were bringing the example of the Me Too. I just want to bring a different example. So I don't know if people have heard of this, but in this place, I guess we now call Canada, in the last year, thousands, and people estimate there's actually tens of thousands, unmarked graves of children who were killed at what are called residential schools, which aren't schools. They're basically places that Indigenous children are forced to leave their families, and like immense violence was enacted upon them. And this is as the last one closed in 1996. And so now, just like in the backyards of these schools, literally thousands of unmarked children's graves are being found. And as a result of that, there has been a huge collective, and this relates to the example Sarah Ahmed is giving in terms of truth and reconciliation in Australia, huge collective outpourings of shame to the government. And in that instance, I think it's an example, perhaps that such shame will change something, but really I think, and like Sarah Ahmed shows this with Australia, I don't think it will, but then it's maybe the political utility of that is actually, Sarah, what you were just discussing, where the shaming isn't really so much about having some sort of effect on the one or the institution, in this case Canada, or the prime minister being shamed, but rather it is about the shaming is for the kind of peer or the collective, and creating that collective is actually what the political act is. And so this is getting me to think more about how I need to think about that part, because when I'm thinking about shame as an unfinished political act, I'm thinking about whether or not it results in a political act on the one who is being shamed. But perhaps it's actually the political act or political
solidarity. The solidarity it might create, yes.
Comes from that, from the collective of the people who are doing the shaming together. So that's really interesting. And that's what you're saying has got me to think about. So thank you. I'm not sure what, I guess with COVID, I guess though the issue with the COVID vaccine example of this is it's created a collective of people who are, you know, pro-vaccine and getting vaccinated, but then that gets us back to the previous discussion with Ken of then creating this kind of like defensive backlash of creating a different collective and different solidarity that is like so strongly anti-vax. So, but I think it's really interesting to shift the focus of where the political act is happening from the political act happening on like the subject or institution who's being shamed to the collective of those who are shaming. And I guess this gets back to the article you linked, Una, about the difference between shaming and shame.
Well, I'm just wondering, I mean, if we're talking about shaming, not of individuals, but of institutions or governments, I mean, if shaming is aiming at inducing a specific emotion in the target, I mean, I haven't really thought this through, but I'm just wondering, I mean, why not just criticize the government, pointing out all the mistakes they made? I mean, why is that not, I don't know, enough? I mean, and I can certainly see, you could say, well, but it's not just about the target, it's also about, you know, the peers. But then I would wonder, I mean, why is shaming the best way? What about, you know, raising righteous indignation? Is that not as powerful? And again, I don't have any clear answers here, but I mean, yeah, I don't. So I'm just throwing this out. I mean, I can see why, you know, why it's very powerful and important to have that emotional bond with one's peers. I wonder whether shaming is necessarily the most efficient way. And I'm also wondering about, I mean, what is the goal of this? I mean, perhaps the goal would be to make the government either apologize or try to reparate damages that had occurred. Now, again, is the best way to make the government, or say, what I know, an international firm who has made similar things, is the best way? Is shaming really the most efficient way? I mean, it's just not super transparent to me. But again, perhaps worse.
I think it might have to do with feeling that the thing that we have been done is to have been ashamed. I mean, they shamed us. We want to shame them now. I mean, it's like turning back.
Okay.
The shame. Maybe this is one.
I have some thoughts. Do you guys know Jennifer Jackett's book, Is Shame Necessary? It's called. She's like an academic at NYU in environmental science or something. She's written a book about the effectiveness of shaming. And basically, her argument is it's only really effective if you're not targeting individuals, but you're targeting institutions or corporations or nation states. Mm-hmm. And what it's about is reputation damage. And that's what motivates change. So you're threatening the reputation of a oil company or of a nation state. And because reputation management is such a strong motivator, like saving face is such a strong motivator politically to get things done and get people to change or get corporations to, you know, they might lose money if they lose reputation. So she kind of argues that it's effective because of those reasons, like it in ways that like just pointing out what they've done wrong wouldn't be, you know, that might just lead to an apology but no change. Whereas this kind of threat to reputation has like a kind of, it's like an existential threat to a corporation or nation state. So that might be a way in to think about why it could be effective.
Well, I certainly think, I mean, it seems very plausible, I mean, to focus on the issue of reputation, but I was just thinking about, I mean, this movie, was it by Michael Moore, about how unhealthy it was to eat McDonald's all the time. I don't know if he ate McDonald's for a month, and I mean, his health really deteriorated dramatically. I'm sure that dealt a lot of damage to McDonald's, but I'm just wondering whether what was efficient here was shaming, and I think they introduced more healthy, versions subsequently, veggie burgers and more salad and so on. But I'm just wondering whether what was efficient here was the shaming part, or basically the brute facts part. I mean, so this is actually what will happen if you eat the products. I mean, again, so I don't know what is most harmful to reputation. Yeah, anyway.
Just quickly on that example, because I just saw Ken put a comment in the chat. He says, it's not clear to me that a government is a proper / possible object of shame. It may be good for solidarity among those doing the shaming, but shaming towards an institution hits those who identify with that institution. I don't know if I agree that it's not proper or even possible to shame a government, for example, or an institution, but the example, Dan, you just brought up, actually, like perhaps one of the biggest harms of that film or documentary was that what it did inadvertently was shame those who do have a diet that is high in fast food and in McDonald's, and feed into like fat shaming and our fat phobic society and how that's intertwined with race and all of that, perhaps more than it did anything really, even though the goal was to shame an institution. And so I think, yeah, Ken, your point gets taken up here really well, where the object of shame, the intended object of shame was an institution, and for the institution to change. But what happened was that it ended up also shaming those who are like use the institution or associated with it in some ways. And then it created its own kind of like, now we have a kind of the system, or like there's even like people will say like the obesity research industrial complex. And this has become its own whole institution system that like fundamentally thrives on shaming fat people. But yeah, so I think that was interesting you brought that example up.
We're almost out of time, but I just wanted to bring it back to like using shaming in public health contexts. And one book I'm putting it in the chat again. One book I read recently is called Lazy, Crazy and Disgusting. It's written by a couple medical anthropologists in Arizona. And they argue really vehemently against the use of stigma and shame. They don't conceptually really distinguish stigma and shame very well, but the idea is kind of there. Looking at how the way that shaming is mobilized in public health is particularly pernicious for people who are already lower down the social hierarchy, you might say, are already suffering from shaming because of socioeconomic status, or because of fat shaming because of living with excess weight, or mental health is the other major theme. And I think that there's a really clear and really important message in their work, and that's I think maybe relevant to the arguments you're making about vaccination shaming, about whether or not it's ever effective, and to bring it back to kind of a moral register, whether it's ever moral. That might be a useful resource. We've got 5 more minutes, but does anyone have any other questions or comments?
Just that if any, I don't think I'm the appropriate person to do this, but if it hasn't already been included, a submission in your collection, there should definitely be one on fat shaming, I think, because in my head, the biggest example of shaming in healthcare around patients has to do with fatness.
Mm-hmm. Yeah.
And I guess I'm glad we got there.
Supriya, do you want to wrap up?
Yeah, sure. So this has been quite excellent. I mean, the whole larger discussion, and we touched upon much more larger themes, of course, in the final session. I'm really glad for this discussion and question and sessions in themselves. But also, I'm happy that Dan could join us and then especially touch upon the phenomenology of shame in itself, which was in the end, but still an excellent way to wrap up the whole workshop series. And yeah, thank you, Maryam, for your talk, which was quite insightful to look at the engagement with shame and empathy and how we can play around when we can use it at the same time or not use it, especially within the public health, discussions right now. And the workshop series has been I have been thoroughly enjoying the last 6 days. I mean, the last 3 months at different intervals. And Luna has been really great and has been helpful with this larger organization. And I have to thank Luna for this, opportunity to co-organize this workshop series. And for all the participants who could join us, and here also for this session, whom we had this discussion. So thank you so much for everyone. And I hope this would be a good break to start for Christmas and for the new year too, to talk about. So Luna, do you have anything else to wrap up?
No, just to say we'll send the recording to everyone, and yeah, feel free to be in touch. It's great to see everyone here. Thank you.
And if you're also working on this theme, it would be great if you could submit for the work, for the journal, for the thematic edition, which we are trying to bring together around these themes.
Yeah, it's in the
Thank
chat
you so
again.
much for everyone.
Great. Thank you. Lovely to see everyone.
Bye. Happy holidays.
Indeed.
Take care.